Discussion of the third cranial now. Here you can see this is the mid sagittal sections. This one is the midbrain. You can see this one is the superior colliculi. This one is the inferior colliculi, and here this part it is the red nucleus on the sagittal sections. Here you can see this is the pons. You can see this is the pons. This one is the cerebellum. This one is the proculus of the cerebellum. This is the fourth ventricle, you can see, and this one is the medulla oblongata. Here we can see the third cranial nerve. It is the oculomotor nerve. The oculomotor nerve which emerging from the midbrain at the level of superior colliculi around to the cerebral aqueduct. There is a gray matters. The third cranial nerves which arise inside the tegmentum, it crosses the red nucleus, anterior part of the substantia nigra, then it enter inside the interpeduncular fossa. This is the interpeduncular fossa between the posterior cerebral artery and superior cerebellar artery. Here you can see this is the superior cerebellar artery, this is the superior cerebellar artery, and it is between the posterior cerebral artery. Then it goes anteriorly inside the cavernous sinus, and inside the cavernous sinus the structure from medial to lateral, most medially there is a internal carotid artery, just lateral to the internal carotid artery you can see this is the sixth cranial nerve. It is the abducent nerve. This is the abducent nerve which arises from the pontomedullary junction and is also enter inside the cavernous sinus through the lateral to the internal carotid artery, and medial it is between the room of the cavernous sinus, and inside the cavernous sinus this is the part, it is the cavernous sinus. The most upper part of the cavernous sinus there is a oculomotor nerve, then there is a fourth cranial nerve, then there is a two divisions of the trigeminal nerve, mainly the ophthalmic and maxillary divisions. Now the oculomotor nerve through the cavernous sinus, it enter inside the superior orbital fissures. Inside the superior orbital fissures, the oculomotor nerve is divided into the two division, upper division and lower division. Upper division it supplies to the two muscles, levator palpebral superioris and superior rectus. These are the two muscles which is supplied by the upper divisions of the oculomotor nerve, and the lower divisions of the oculomotor nerve which supplies to the medial rectus. It also supplies to the inferior rectus, and it also gives the branches to the inferior oblique muscles. It is the longest branch. Here you can see this oculomotor nerve. It also carries the Edinger-Westphal nucleus. It is also around just on the side of the oculomotor nucleus, the Edinger-Westphal nucleus, which carries the parasympathetic fibers for the ciliary ganglions. It passes through the oculomotor nerve, and after it enters the oculomotor nerve inside the superior orbital fissure, it divides into the superior and inferior division. The fiber of the Edinger-Westphal nucleus which is passes along with the inferior division, and it is relay inside the ciliary ganglion. This one is the ciliary ganglion. This fiber which is relay inside the ciliary ganglion lies between the lateral rectus and optic nerve. Then the parasympathetic fibers of the ciliary ganglion, the postganglionic fiber through the short ciliary and long ciliary, it supplies to the sphincter pupillae, and the sympathetic fiber along with the internal carotid artery, it gives the branches to the ophthalmic artery, and ophthalmic artery carries the postganglionic sympathetic fibers. It does not relay inside the ciliary ganglion, it supplies to the dilator pupillae. So this is about the third cranial nerve.